evening, ladies and gentlemen who have joined us this evening. I'm so happy to have you here once again this evening to discuss very important matters that affect us as women and also as human beings. Daktari today was the first one to join, so well done. I think he must have enjoyed the first two sessions very much, so he made sure that he was here early enough. So thank you so much, Daktari, and thank you, listeners, for joining us. Once again, for all the questions that you have this evening, please type them at the Q&A session, and then we will read them. Now, last session, I promised some of you who we had not answered their questions that we are going to quickly look through those questions before we start the session today. The session today is about the pregnancy journey. And the pregnancy journey is not just important for pregnant women, it's important for all of us because there are some concepts that we need to understand, maybe, and how it affects our children, or how it would affect our children, or how we are trying to conceive or not. So it's a very important session for everybody. Anyway, Daktari, say hello so that we can know that your voice is on. We cannot hear you. We can't hear you yet. I think you have two devices. One of it is saying connecting to audio. Just check. Not yet. Let's give Daktari a few minutes so that we just confirm the audio is working.
Sasa tena ananipigia kila siku. Na kazi tumemfanyia. Sasa unajua kazi ya kufanya nini? Hata leo nimwambia kama ushamaliza.
Hi, Fatma, kindly mute.
Ni profitable.
Can you hear me now?
Yes, now we can get you loud and clear.
Yeah, I had a problem with my laptop.
Okay.
Now I'm on my phone now. Thank you.
That's fine. Thank you so much. So Daktari is live, loud and clear. So Daktari, as we promised our listeners last time, we had about 10 questions not answered. I think it will be very nice if we keep our promise, answer those questions, then we can start our story on the journey of the pregnancy, even as other questions come in on pregnancy. So I have a few questions here. I have one question, I think it must be from a man or from a lady who asking on behalf of their men. What's the main cause of UTI in men?
UTI in men can occur both in younger men or in older men. When it occurs in older men, sometimes it could be a result of prostate infection. There's a small gland which all men have. It's called the prostate. If
Okay.
it gets infected, then older men can actually have urinary tract infections. For the younger men, let's say below 40, the commonest cause of UTI is sexually transmission. Yes, most likely they've acquired it through sexual contact.
Okay. How much does the cystoscopy cost? I think this is removal of cysts.
Oh, cystectomy.
Yeah, I think must be, they've said cystoscopy. Cystoscopy is looking through, yeah?
Yeah, cystoscopy is where you use a video camera. And this is where you use a video camera to look into the bladder. Especially for people who are having recurrent urinary tract infections or urinary tract issues. We take them to theater, and with the use of a camera, we can insert a probe through the urethra and into the bladder. Then you're able to view the walls of the bladder. And it can be done in all the major hospitals. And the amount varies from hospital to hospital, because in public hospitals it's much cheaper, but in private hospitals, it can be done as a daycare. It is anything between approximately with public hospitals about 50,000, and if it is maybe public hospital, total cost may be about 100 to 150,000 Kenya shillings. Okay.
What causes reduction of amniotic fluid without leakage in premature pregnancy?
Whenever you have reduction of amniotic fluid in pregnancy, it can occur as a result of two things. One, it can be due to leakage.
Okay.
Or number two, if you are not leaking, remember who produces amniotic fluid? It is the baby. It's basically baby's urine.
What?
After 20 weeks, amniotic fluid is baby's urine. So the baby swallows the urine and they urinate it. So that means the baby producing urine that is required. And that can be a result of problems like high blood pressure or issues of where there is reduced blood flow to the baby. If you have reduced blood flow to the baby for any particular reason, then you'll have reduced amniotic fluid without any leakage.
Okay. I had adenomyosis with treatment. I got better, but then now I have fibroids and endometriosis. What could be the cause of all these uterus issues?
Probably one of the causes of that is if you do not have babies, then the uterus misbehaves. It's very important that endometriosis can even occur together with fibroids. It can even occur with adenomyosis. They can actually occur, the three of them together. And it is possible maybe even the time she was having the fibroids, maybe she already had a bit of endometriosis and adenomyosis. So they can actually occur together. And the commonest cause of it is, as we said the last time, is that African women are more prone to getting fibroids. And also when you do not get maybe babies early enough, or then you may be prone to, fibroids, adenomyosis, endometriosis. Endometriosis and adenomyosis, their causes are not completely known. It's still work in progress, but we tend to see them, we're even seeing them more in adolescents also. And but they tend to occur in women between the age of 15 to 49 years.
Okay. I am learning a lot, thank you. What causes POS? Is it curable?
Must be PCOS.
Yeah, must be PCOS.
This basically means polycystic ovarian syndrome. PCOS means polycystic ovarian syndrome. This is a syndrome where you have the ovaries having very many cysts. It's a form of hormonal imbalance.
Okay.
And so you tend to have, irregular menses. You tend to have sometimes, what you call, like loss of hair on the sides of the head, some little hair on the chin or on the chest. And we may also have a bit of weight gain around the tummy. The actual cause is unknown. And people speculate that one is born with it. It cannot be cured, but it can be managed through diet, through weight loss, through exercise, and through medication, which if you want to conceive, the medication it can be given to help you to speed up conception. And if you do not want to conceive, it can be put on the combined pill, like the family planning pill, which helps to control the periods and the abnormal hair growth.
Okay. Can the hysteroscopy be carried out during pregnancy?
Hysteroscopy?
Yes.
Also.
Can it be carried out during pregnancy?
No, hysteroscopy, no, because hysteroscopy, you're already looking into the uterus and there's already a pregnancy there. Or is she talking about a hysterectomy?
No, she said hysteroscopy.
Okay, there's a difference. Hysteroscopy is where you look into the uterus. And you cannot do that during pregnancy because you're already looking into where the pregnancy is already. So that means it would cause a miscarriage. But if she was talking about hysterectomy, which is removal of the uterus, yes, that can be done during delivery.
Or during delivery, not during pregnancy.
Yes, the uterus can be removed, yes, during delivery.
Okay. I experienced some light pinkish bleeding, which is very unusual. I'm sexually active. Could it be implantation bleeding? How do you differentiate?
Implantation bleeding tends to occur almost at the time you are supposed to get your periods. And typically how it happens is that it is very light and maybe even be bright red. And it is not as much as the menses.
Yeah.
And sometimes most ladies, they confuse it with their last periods. But the typical thing is implantation bleeding almost coincides the time you're supposed to have your menses, and it must be lighter.
Does this occur maybe consecutive days or is just one day?
It can be a day, can be 2 days, can even be 3 days.
Okay. Wow. What would cause placenta calcification?
Normally, placenta calcification is part of a process called aging of the placenta. This is normal, but we worry if you get what we call placental aging early in pregnancy. Because from that trimester, we can grade placenta aging. And this is how we look at it in terms of calcifications on the placenta. If it is excessive, then we say this placenta is aged in excess of what is expected. And this can be caused by things like reduced blood flow to the pregnancy unit, especially high blood pressure is notorious for that, what we call preeclampsia in pregnancy. So there is what you expect, some placental calcifications or aging in the third trimester. But if it is excessive, then the time we worry.
Okay. Do young girls and babies get yeast infections?
Young babies and girls do not get yeast infections.
Okay.
They can get urinary tract infection, which is very common, or bacterial infections, but they rarely get yeast infections. Yeast infections is mainly for women who have started producing estrogen, the ones who have started having their periods.
Okay. Fine. And the last question of the night of that session is that is there a disadvantage of elective surgery? I think this is when they're going for cesarean section. And how do you heal a surgical wound in warm weather?
Wounds heal well, by the way, after cesarean section. The key thing is keep the wounds covered for the first 1 week. And if for women who have maybe what we call like a large tummy, which is covering the scar, then it is best to keep that tummy overhanging the scar, maybe to pull it up.
Wow. Now, how do you pull it up?
You can use the different things you can use. You can use the ordinary lasso to tie your tummy. You can use the tight panties to help to push the tummy up. That is for women who have a large tummy, which is covering where the cesarean section scar is.
Okay.
But for good care, for cesarean section scar, the key thing is keep them covered for the first 1 week. And then after that, after 1 week, you can expose them. And usually the scars heal very well.
Okay. So the question she asked first is there a disadvantage in elective surgery, in elective cesarean section?
No, there's no problem of scars in elective surgeries.
Okay, thanks. So those were questions for last time. This evening, we are beginning on the journey of pregnancy. I can see some questions have come in. So Daktari, would you want to just give us an intro before we do the questions, or do we go to the questions straight?
I think we can do the pregnancy journey briefly to take maybe like 10 minutes.
Okay.
Then we can do all the questions can come in, even from the presentation.
Okay. Fine. So go ahead.
Good. So good evening, viewers. Today we are going to talk about, my presentation is on short presentation on about the journey of pregnancy. There's a journey which a lot of women and couples would love to have at one time in their lifetime. And it's a journey which is always anticipated with lots of joy. And sometimes it can also end up not so well. Sometimes it can also end up very well with a nice bundle of joy. Typically, we know that pregnancy lasts for about 40 weeks. And how do you calculate pregnancy dates? How we go about it is you calculate from your first period. Anytime you go to your doctor and he asks you for your last periods, always mention the first day of your last periods, the first day of your last periods. And from this, we're able to calculate your expected day of delivery, which we basically do mathematically, where we add 7 to the date, and we subtract 3 or add 9 to the month, and be able to get your expected day of delivery. Now, this can be calculated through applications on the phone. There are phone apps which are able to give you approximate dates. Remember, it's an expected day, so it's not an actual date, it's an expected day of delivery, of confinement. Conception occurs when you combine an egg and a sperm, and you have when the egg and the sperm are combined, they form what we call the fertilized egg, which is able to move to the uterus where it gets implanted. By day 6, you'll find that fertilized egg is already in the uterus. And by day 7, the baby is already implanting and producing hormone, what you call like the pregnancy hormone called the HCG, which forms the basis of the pregnancy test. You'll find when you use the home kits, especially, you'll find by the 4th week from your last period, or by the 4th to 5th week, you are able to get to know whether you're pregnant or not, using the home kit with the urine testing. By week 2nd, from your last periods, and if you're pregnant, or by the 3rd week, we can actually do a pregnancy test by blood, and it is able to detect that hormone, which is already produced by the baby when the baby implants into the uterus. Now, pregnancy, is always remember that it is from 0 to 40 weeks, and it is divided into 3 phases. And these phases are very important because they're important to the woman, to the couple. They're also important to the doctor because different events occur in each of these 3 phases. There is what we call the first trimester, then you have the second trimester, and we have the 3rd trimester. So let's begin the first trimester. What happens the first trimester? There's a stage you enter between week 0 to week 12. After the 12th week, it is so important to us because this is the most important period in terms of organ formation. By week 12, you find the baby has formed nearly all the organs, whether it is the brain, whether it is the heart, whether it is the limbs, everything has been formed by this time. What those organs are waiting now is to become bigger and to mature. And you'll find that at this time, the commonest problems we face at this time for the ladies is a lot of nausea. This nausea and excessive spitting of saliva, this is caused by the various hormones which come into play, especially the hormone called HCG, causes a lot of nausea and also excessive salivation. Then you also have a lot of breast tenderness. You feel a bit sore. You feel excessively sleepy, especially in the morning. You don't want to wake up. And this is because of the hormone progesterone, Progesterone causes a lot of sleepiness in the morning, where you find you're not even able to wake up in the morning, you're feeling a bit lazy. This is because of the hormone progesterone. You may also find yourself that you're passing urine many times. And this is also part of the pregnancy, as it is compressing on the bladder in that early stage. Usually you have no baby bump at this time. So most people only be known that they're pregnant only if they're showing signs of excessive, vomiting, or because they have done a test. But people out there may not notice that there's a baby bump or not. When you go to the doctor at this time, this is the time we recommend people go and see their doctor, because it's the time we do all the tests which are required, what we call the antenatal profile, where we check for your level of your blood, we do the STI screening, total blood count, we do a blood grouping, we do a blood sugar, and a urine test, which is supposed to be done each visit when you visit your doctor. And this is also the time we start you on folic acid, because folic acid helps to prevent abnormalities of the brain and the spinal cord, also heart problems. So folic acid supplementation is very important for all pregnant mothers, which should be begun during this first trimester. This is the time you also need to do an early scan, because you find that the scans done in the first 3 months are extremely accurate in calculating the expected day of delivery, especially when the mother doesn't know when her dates were, or maybe she was using some contraception or not. So you'll find that this period is a time mothers feel a bit sick, they feel unwell, and they're feeling moody, and the baby bump is not showing. And let me say this, if you are feeling excessive vomiting, excessive sleepiness, it's a good thing, because it shows that the pregnancy is going on well. When you do not feel any of these symptoms at all in the first 3 months, then something may be wrong, because when you get pregnant, you must always feel something unusual in your body. This is the time complications come in pregnancy. What complications do we have in the first 3 months? The main one is miscarriages. They're extremely common around this time. The first 3 months, especially before the 8th week, we find a lot of our women losing their pregnancies, and the causes are very many. Women can even lose once, twice, 3 times, 4 times, and which can be very, very unsettling for many couples, because where they may not even go past the 8th week. So it's important to note that the major danger sign in this time is actually bleeding. Now, when you also go to your doctor, you're also told you must also change your lifestyle, because you're pregnant. There are things you need to avoid doing. Things like eating liver, alcohol, bad habits like smoking weed, smoking cigarettes, eating seafood. So those are things, taking coffee, those are things which should be stopped during pregnancy. And even dangerous activities, like lifting very heavy weights, going to saunas. These are things which need to be stopped during pregnancy or limited during pregnancy. All foods should be fresh in pregnancy, because you are more prone to food poisoning at that time. And this is a time, of course, as I said, the baby is forming the important organs. We come to the second trimester. This is a time now women feel alive, because it is like they have come from a place where they are seriously feeling so sick. And the second trimester is one of the best times in a woman's pregnancy journey, because there's a time they feel so energetic. There's a time the baby bump starts showing. There's a time they're more active. There's a time they can travel, they're energetic. And there's a time also the baby starts growing in length. And the key thing which happens to babies around this time is that they start growing in length. And they also start moving. You find for first mothers, the movements start about 19 weeks on average, where you start feeling a flutter. For the women who have delivered once or twice, the movement starts a bit earlier, from about week 16 or even week 17, which feels like a squirm or more like a flutter. And there's also beginning to feel the signs of pelvic pressure, where you start feeling issues of, your bones down, really feeling a lot of pressure. The baby is almost coming out. You almost feel, you get those weird sensations. And it's important to understand this is normal. Feeling of that, like almost like the baby is coming out during this second term, which ranges between week 13 to 28. It's common because of the loosening of the pelvic bones. Some of the tests we do as doctors at this time include a very important scan we do at 20 weeks, which helps us to know that you're carrying a normal baby. It's also the time we can also know the gender of the baby. We can also know the gender of the baby, where the placenta of the pregnancy is located. We also confirm whether you're carrying one baby or two babies. So it's a very important period, especially 20 weeks, to have the scan done. All women must have what you call abnormality scan done at 20 weeks. It's also important nowadays that at about 16 weeks, we are recommending that all women above 35 years should do what you call a triple test. This is like a test for Down syndrome, because we are beginning to see quite a number of abnormalities in our pregnancies, especially for older women. And this can be detected early. At 16 weeks, we recommend certain blood tests called the triple tests. And but it may tell us whether there is a chance that somebody may be carrying a baby with Down syndrome or not. Though it's not always automatically 100% correct. Tetanus injection is a time we also do our vaccination. The vaccination we do for clients in this country is tetanus injection. There's no other vaccination we really do or we recommend for mothers in this time. So it's important to understand that at this time, there's a time now danger signs of pregnancy can come in. And you need to be advised from 20 weeks onward. What are the danger signs of pregnancy? Because every mother needs to understand what needs to make her go to hospital. And there are usually 8 danger signs. One of them is bleeding. The other one is draining of water. The third one is signs of high blood pressure, where you start swelling up, you start having a bad headache, you swell your hands and face. The other one is severe abdominal pains. That's another danger sign. Baby not playing. That's another danger sign. Another danger sign is a lot of dizziness, which is a sign of low hemoglobin level. We also have the issue of fever. And of course, fever nowadays, we also now think of COVID, which is also becoming more common. And also breathlessness, which is also another sign of COVID. And initially, we used to think also breathlessness, excessive breathlessness, because pregnancy can cause breathlessness, but excessive of it nowadays can be due to COVID, or initially what used to manage as maybe signs of clots in the lungs. Diabetes screening is mandatory nowadays from week 24 to 28. Every mother must undergo diabetes screening nowadays. It's an extremely common cause of stillbirth. Diabetes and high blood pressure in pregnancy contribute significantly to a number of stillbirths in our mothers. So it is good to know that this screening test must be done for all mothers from the week 24 to 28. Towards the end of the second trimester, this is a time now one needs to start sitting down with the doctor and start organizing what we call a birth plan, which now comes to the third trimester. In the third trimester, what happens in the third trimester, which occurs from week 28 to delivery time, is that the most important thing at this time is the issues of weight gain for both the mother and the baby. The mother becomes increasingly more tired. The baby at 28 weeks weighs about 1 kilo. And from every week, that baby will be gaining at least 200 grams per week. And the mother will be gaining half a kilo per week. So you find that half of the pregnancy weight gain is actually done in the third trimester, because mothers on average between 6 to about 15 kilos in their pregnancy, but half of it is gained in the 3rd trimester. Because this is the time babies gain a lot of weight, because now they are long enough. Babies now have formed all their organs. So it's basically a time for just putting in a bit of flesh on this baby, and even bones become now even stronger for this baby. So the mothers increasingly feel very tired. They're gaining more weight. They start swelling on their feet. They start, their faces change a bit. The pressure on their pelvis is even more. And of course, the uterus starts contracting a bit because it's also helping to transport the blood to the baby because of this increased energy demand. So you find you have what you call Braxton Hicks contractions. These are physiological contractions which happen. And you find they're important, although most mothers may confuse them to be labor, but eventually these are the ones which become labor. And you'll find that in that trimester, the other thing you must do is that it's important not to sit with your doctor and have what you call a birth plan from week 28. It's very important to have a birth plan so that you know which hospital are you going to deliver at, who will be a birthing partner, what is your mode of delivery, what pain control are you going to have during labor, what are the costs involved, what are the insurances, which insurers are able to cover for your maternity, and how much do they cover, how much do you need to top up, who transport you in case of labor pains, emergency, do you have any access to maybe ambulances if you have none, like during these COVID times, do you have the numbers for the hospitals? Whom do you need to inform? So birth plan needs to be very elaborate. But this is done from week 28 and above. This is during the 3rd trimester. It was the time we also advise mothers from around maybe week 32. You need to book the hospital now. You need now to make a decision and know which hospital to book. It's also the time when people can do Lamaze classes. Lamaze classes are now being offered all over this country, both in public hospitals and in private hospitals. They tend to be done from that 8 weeks. They are birthing classes, basically just to enrich the mothers or the couples on what to expect during labor and delivery, and even during breastfeeding. You'll also find that during this time, the time most mothers develop what you call a nesting instinct. They start now thinking, I need to have a bigger house for my baby. I need to have a baby cot. I need to have a baby shower. So the nesting instinct starts kicking in because now they realize the time is near. So this is the period where now also the complications of the danger signs, which we talked about, the 8 danger signs, there's a time they are more likely to occur than any other time. The bleeding, the water coming out, the premature labor, the effects of high blood pressure, they tend to be much more common at around this time. Non-essential travel needs to be restricted because you'll find, even before these COVID times, medical people, we as medical healthcare workers, we have no issues with people traveling up to that 6 weeks. But after that 6 weeks, it's important to really limit your non-essential travel. And you'll find that at this time, when you reach now what you call term is when there's a way we now divide term into early term and full term and post-term. Early term is what we call that 7 weeks. This is the time you say, if a mother has been having problems, then we can just push her a bit up to about that 7 weeks. That 8 weeks. Full term is actually 39 weeks and 40th week. 41 week, we know now you are now going past what we call late term. And we like our mothers to deliver between week 38 to week 40. That's the most ideal time for delivery. Anything beyond that, then you are more likely to get into problems. And especially if you start going past 42 weeks, that is even too late for you. So at this time also, it's also very important that as you prepare for delivery, it's good to have supplements. Things like iron supplementation, things like multivitamins, things like omega-3 supplementation. There's a time they're given in the 3rd trimester. The key thing about that trimester is that the mothers feel heavier and the baby grows heavier. So they need to rest more. The sleep is less, but the key thing resting does not mean sleep. You just need to rest because this time you may not even feel a lot of sleep. Acidity is also another big problem around this time. And one of the key things of preventing acidity at this time, because the stomach is pushing, the pregnancy is pushing the stomach up. You need to learn how to sleep with many pillows, as if you're almost half seated. And also to take antacids. Antacids, especially the liquid antacids, are also very good because this reflux or acidity tends to occur more at night. So that trimester is when you know that you're going to deliver. And the key thing is have a very good birth plan. Just know that you're going to add more weight per your baby and discuss with your doctor, when are you going to deliver and your mode of delivery? Because it's very good to have the exact timing of when you're expected to deliver so that you don't deliver too early and again don't deliver too late, because each of them have their own disadvantages. What about during delivery time? The key thing is you need to know by now what are the danger signs of labor. What do you look out for? How do you notice labor? Labor is basically where you have pain coming every 5 to 10 to 15 minutes. It's regular. It is increasing in amount, and it does not stop. It continues to be there until you get that baby out. So labor pain does not really stop as compared to forced labor or Braxton Hicks. Issues like draining of water, bleeding, then that means one must now rush the hospital. And you should have organized with your doctor or the hospital of the mode of your delivery. Then after delivery, the most important issues about that is about baby care, breastfeeding issues. How do you bathe the baby? Baby naming. Where do you go after delivery? It is so, so important. What medication do you need? What about the care of the cesarean section scar? What about the care of your maybe episiotomy if you have had a vaginal cut during delivery? So also about the care of your breasts, the care of your tummy. And also the issue thing after you deliver, feeding is very important for the mother. And we usually say, drink more, but eat for one. Try to drink much more as compared to the eating so that you can have more fluid and you don't have also excessive weight gain. Reviews after delivery should be done how you discuss with the doctor, your own doctor, depending on where you're coming from. Maybe, did you have any complication? Did the baby have any complication? Most important thing is to know that ideally most reviews after delivery are spaced between normally 1 week after cesarean section, 2 weeks after normal delivery, and also that should be the first visit. And the second visit should be after 6 weeks when you discuss issues of exercises you need to do, family planning methods, Kegel exercises you need to do, and even baby vaccinations. Thank you very much.
Wow, thank you, Daktari. You have given us a complete journey from the time conception begins to post-delivery. So thank you. And yes, questions have just been coming as much as you've been talking. Now, to the questions. And one question that is very close to my heart because I am a victim. Hyperemesis gravidum. Why and what is it?
Yeah, hyperemesis gravidarum is it's a double-edged sword. It is it's excessive vomiting during pregnancy, and it seems to affect women differently. You may find even during this pregnancy you didn't vomit a lot. This pregnancy you're vomiting a lot. This is why you continue to vomit and vomit and vomit. You're so nauseated, and it cannot be fully prevented or fully treated. It can only be managed. One of the ways of managing when you have a hyperemesis gravidarum is keep drinking even if you don't feel like, because it is like a cycle which never ends, in the sense that pregnancy itself is causing you to be nauseated. And when you have nausea, you vomit. When you vomit, you get dehydrated. The same dehydration makes you even more nauseated. So like now you're having two issues now harassing you, the pregnancy and the dehydration.
Yeah.
So usually what you do is that try to drink as much as you can if you're able to. You can also explore the use of natural anti-vomiting, like ginger is a very good natural anti-nausea. use of medical anti-nausea medicines like, there are many on the market nowadays you can use. And also learning how to sleep, avoid lying flat. Always sleep with a pillow as if you're almost half seated. Because usually what happens that it is bile which tends to go back to the stomach, and the stomach churns. So the key thing is try to stay, if you are lying in bed, with yourself half seated. And before you sleep, take something which like a dry toast or some dry biscuits, which helps to absorb that bile so that you have less nausea. But most importantly, it is very common between week 7 to week 10. In fact, week 9 and 10 are the worst.
Why does it affect some women and not others? Because there are other women who go through nausea and morning sickness or all the day sickness, but hyperemesis is on a different level. So what is so unique about those women who go through hyperemesis?
There are many theories on this, and people have always trying to postulate, because you can also find that in the same woman will have pregnancy number 1, she had extreme nausea. Pregnancy number 2, there's no nausea. People have tried to look, is it because boy babies give this or girl babies give this? No. Is it vitamin D supplementation? No. Is it type? So a lot of research has gone into it, but there's nothing really conclusive, because it looks so haphazard. It can occur on anyone.
So it's just one of those nature things that cannot be explained.
That's true.
Okay. So another question here, when is it safest, after how long, to try getting pregnant after a major myomectomy?
After fibroid surgery, you should aim for conception within 3 months. After 3 months, you are safe to start conceiving.
So they give themselves a break of 3 months?
3 months. After 3 months, you can conceive.
Okay. A listener here, they gave birth 1 year, 2 months ago, and yet their periods are not back. Is this normal?
It depends. Periods may stay for between 4 weeks, even for 1 year, without coming after delivery. It is very unpredictable. More so if you start also using like hormonal methods. But of course, after 1 year, the periods have not come, and one is not breastfeeding, then one needs to be checked by a doctor to see whether there's any other problem.
Okay. I had myomectomy 5 years ago. Can I have a vaginal birth, or do I have to go through CS?
You'll find that as a general rule, if you have had fibroid surgery, we advise mothers to undergo a C-section, because it tends to be safer. Okay. There are some fibroids which are found on the surface of the uterus, where you don't have to go into the womb completely. They are just on the outside. If you just have the fibroids, then one can attempt a vaginal delivery.
Okay. Can Asherman syndrome, in brackets Synechi, I think Synechi, be cured, and can you carry baby to term after treatment?
Yes. Asherman syndrome occurs when you have Synechi or maybe scarring within their womb. The treatment is you go to theater. Through a camera nowadays, we are able to dissect most of the scarring tissue and put you on medication to rejuvenate the lining of the uterus. Yes, we have seen successful pregnancies after Asherman syndrome. Yes, there are also other Asherman syndrome which are so severe that one may not be able to use her womb to carry her baby fully to term. She may have to borrow somebody else's uterus to carry her baby to term.
Okay. Do aged women over 60 years get fibroids? And if so, what signs do they show? And do they experience pain?
After menopause, at the age of menopause, in this country, the average of menopause in this country is 51 years. And you'll find after 55, most women don't get periods.
After 55?
We do 55 years.
Yeah.
It's like the last age of menopause, of bleeding, of monthly bleeding. We don't expect women after menopause to get fibroids. If there are new fibroids coming up, After menopause, after 55 years, they need to be checked so that it's not cancerous. So the only fibroids that they're supposed to have are the ones they came up with from when they were maybe 45 or 30s, 40s. But after menopause, you should not get new fibroids coming up. They should not increase in size. If they increase in size or they increase in number, something is wrong. That needs to be checked urgently.
Okay. How can you manage the nausea? I think this is a nausea issue again. How do you manage the nausea?
In pregnancy?
Yes, in pregnancy.
I'm assuming this is in pregnancy.
In pregnancy.
Nausea in pregnancy, you try, it's more of managing rather than complete treatment. And it's good to know that it is worse between week 7 to about week 10, 11. Then it goes down. You can use oral, there are some oral medicines you can use, like some of them like Norsic, Peridoxine, things like Ondansetron. There are several in the pharmacies the doctor can prescribe for you because they are prescription-only medicines. You can also use ginger, which is a very potent anti-nausea. Use of dry biscuits, use of dry toast, how you sleep on your bed, make sure that you're half-seated. Avoid eating and sleeping immediately. Maybe have an hour or two before you sleep. So all those things help a bit, but they do not completely eliminate nausea.
Okay. Does seafood include fish? I think that is one of the things you've said women should avoid during
I'll talk about the
pregnancy.
deep seafood. Deep sea, not the kawaida fish like tilapia. That one is okay. Talking about deep seafood like calamari, things like lobster, crab, those exotic seafoods.
Okay. What are the symptoms of Down syndrome in a baby, especially if it's mild?
Which one?
Down syndrome, what are the symptoms, especially if it is mild?
A Down syndrome in a baby, babies who are born Down syndrome, they're usually very lovely babies, by the way. And the symptoms they may have is that if you look at their palm, they may have a single crease on their arm. They may have a bit of low set ears. They may have slanted eyes a bit. They may have the difference between the first digit and the second digit may be a bit wider. They may have maybe a thicker neck, and they may also have a flatter chest, which is broader. And their arms may be more, angulated. And they tend more of the time to be girls. We are seeing them quite nowadays. And they are lovely babies.
Okay.
And they grow well.
Okay. Yeah, I've seen a couple and I think they are very lovely babies.
Yeah.
For women with back curvature, for women with back curvature lordosis, does it get worse in pregnancy?
In pregnancy, there are some problems which occur naturally, and it's good for all women to know this. Constipation is one of them. All women get constipated during pregnancy. Low backache is part of pregnancy journey. Almost all women have a low back problem. So that if you already have a low back problem before pregnancy, you tend to have it even more during pregnancy and even a bit after you deliver. The other problem, which is also quite common in pregnancy, is of course heat. You're always feeling hot all the time.
Yeah.
That is common. That is expected. And the other issue is also, sometimes, mood changes. Sometimes you're happy, sometimes you're feeling so sad, sometimes you're crying, sometimes you're energetic, sometimes your energies are low. So all those are part of the pregnancy package.
And what causes those mood swings?
Is the hormones. Because the hormones in pregnancy really go up. All the hormones in pregnancy, which are expected in a woman, they are tripled or quadrupled. The progesterone, the estrogen, the HCG, they are all very high, and they can really play around with the woman's emotions.
Are they the same cause of cravings, food cravings?
Yep. Food cravings can also come because of some deficiencies or because of the hormones also.
Mm-hmm.
If you also may be lacking some iron or some nutrients, you may start craving for things like soil when it rains, or some soil from ant hills. So it could be due to two things, either the hormones or maybe you're lacking that nutrient in your system.
Okay. For women in 40s looking at conception, are there any medical tests that can predict what triple tests would discover late in the journey of pregnancy? Can they do a pre-test before the triple test?
No, it's difficult to do a triple test before, because the key thing is to know that the quality of eggs dramatically falls after the age of 35 and much more after the age of 40. So in your 40s, when you're trying to look for a baby, the key thing is, are you able to conceive? Because also the quality of the eggs is, the eggs are fewer and also the quality is a bit low, but you can still conceive, and many conceive, by the way.
Okay.
So we advise them when they reach the age of 11 to 13 weeks, you can do an early abnormality scan where we check on the neck thickness. And what you look for, the cutoff is 3 millimeters. That is the neck thickness at about week 11 to 13. And then at about week 16, then we do what we call a blood test for the mother. It's called the triple test or the quadruple test, which will help us to know, are you in the safe side of Down syndrome or not? Okay.
Is a false pregnancy true condition?
Is that?
False pregnancy, is it true?
Pseudocyesis. It's called pseudocyesis. We have, yes, it happens a lot. It's almost like a psychological problem, especially for women who have been looking for babies. They actually seriously feel they're pregnant, their tummies even grow, and they even feel nauseated. They act like they're really pregnant. And when they come to hospital, when you maybe give medication to relax, when they are not able to feel themselves, you find they're not pregnant.
Wow. Okay, that's now. So how do you help such women?
It's a psychological problem. Okay. So they need to be counseled. They need to be helped. Their medication we can give them to assist them, but the main thing is psychotherapy.
Okay.
And more of emotional support.
Okay. I know you probably explained this when you're explaining hyperemesis, but maybe you can just repeat for the sake of this listener. My nausea and vomiting increases when I'm hungry. Is that normal?
Yes, that's true. Actually, when you're pregnant, we recommend this. Eat something every 3 hours. Don't eat a full meal. Like the way we take breakfast, you take lunch, you take dinner. It's recommended that when you're pregnant, take small, frequent meals every 3 hours. Because when you're hungry, because you tend to utilize your food very quickly, and if your tummy is empty, then you feel nauseated. It's just like breastfeeding, it's supposed to be every 3 hours. So it's even pregnant. When you're pregnant, don't wait for lunch, don't wait for dinner. In between, take a snack, take a fruit, take a cup of chai.
Just ensure you have something in your stomach.
Yeah.
Okay. What do I do or take to help stop snoring? I am 29 weeks and the snoring started last week. We all go through that.
Yeah, snoring is very common in pregnancy. This is because when you're pregnant, the air passage in your nose and your mouth, they get larger and softer. So as the air passes through your nose, it produces that vibration sound. So sometimes can have somebody who never used to snore, but you're pregnant, you start snoring. And that is common. Because of the physiological changes.
Is that also why they say the women's noses grow bigger when they're pregnant?
Yeah, they grow a bit wider, yes.
So it's true, they grow wider.
It happens. This is temporary.
Okay. What causes clefts in babies?
cleft lip is not something which has been understood properly because it's not an inherited problem. And it's what we call like a mutation. It's like a combination of genetic and environmental factors which are not completely understood, but can be diagnosed at 20 weeks. At 20 weeks, when you're doing the abnormality scan, we can actually see, the cleft lip or the cleft palate. Luckily, cleft lip and cleft palate can be sorted out after delivery and completely. So there are some conditions can be completely cured.
Given that it's something that is inside the mouth of the baby, how do you detect it at 20 weeks?
Because it's something structural. You can actually see it on scan.
Okay.
Yes.
Okay. Is it safe to have sex during pregnancy?
Yes.
Okay.
Up to 36 weeks is recommended.
Up to what weeks?
Up to 6 weeks, yes. Yes. Unless your doctor tells you no.
Okay. Why up to 36 weeks? What happens to week between 37 and 40?
By then, the mothers are too uncomfortable.
Okay. So other than discomfort, nothing else prevents?
Yes.
Okay. Can preeclampsia be prevented?
Preeclampsia it tends to occur mainly in the first pregnancies, and also in people who already have underlying high blood pressure, or people who have underlying kidney disease, or people who have diabetic, other comorbidities. So nowadays we're able to prevent it, but not 100%, because it may just arise on its own. But if there's also a chance it can occur in the next pregnancy, there's a 10% chance it can occur in the next pregnancy. So if it does, then we're able to put you on something like calcium or junior aspirin, which help to basically reduce the severity of the preeclampsia. So for people who we suspect they may be conditioned to getting preeclampsia, yes, there are some supplements you can put them on, which help to reduce the severity, not the disease itself, but the severity of the illness.
Okay. So if a patient gets preeclampsia during pregnancy, what are some of the precautions to look out for, even as they carry the pregnancy? Yeah.
Preeclampsia is a serious illness.
Yeah.
And it's one of the commonest causes of death in our pregnant mothers. It's one of the commonest causes of preterm deliveries of our babies. So it is something which is quite serious.
Okay.
And what we advise a mother with preeclampsia is she needs to make frequent visits to her doctor. And she needs to stay in contact with her husband and her doctor, because things can change. You need to be put on monitoring, a blood pressure monitoring. You may need to be put on antihypertensives, check on the baby movements. And ideally, if it is severe, we aim for 34 weeks. If it is mild, by that 7 weeks, she needs to be delivered.
So can she deliver normally, or is this a cesarean section case?
It depends. If it's after 34 weeks and there are no other reasons which we feel may put the mother or the baby at risk, she can deliver vaginally.
Okay.
Actually, preeclampsia mothers can deliver vaginally. The only time they undergo a C-section is if there's an emergency on the mother or on the baby. Okay.
Now, what's your advice on the long-term side effects of epidural injection or spine injection?
But they are different, epidural and spinal. Epidural is what we use for normal labor to give pain relief for mothers during labor. It almost gives you 100% relief. It is given during labor, active phase of labor, when you're at least 4 centimeters. It doesn't knock off labor, but at least it knocks off the pain. And it's the only problem with it is that during pushing or during second stage, during delivery of the baby, you may be assisted by maybe vacuum or forceps to have the baby delivered, because sometimes may not be able to push as well.
Yeah.
And also your blood pressure may go down, but at least there'll be a doctor checking you on that. Spinal anesthesia is basically used for major surgeries. It's not used for labor management. So that one is a form of anesthesia, basically to undertake major surgeries like cesarean sections or hysterectomies or any other surgeries you need to be done.
Okay.
And the commonest problem with the spinal anesthesia is basically headaches. Especially a week, maybe from day 1 to day 7. Although nowadays, depending on the needle used, you'll find out that people presenting with headaches are much less.
Okay.
And we also encourage the mothers to take lots of fluids and coffee if you have spinal headaches.
Okay. What does coffee do?
Coffee helps to reduce the headaches in mothers with spinal headaches.
Okay.
Caffeine, basically caffeine, or any medicine with caffeine.
Yeah. Now, is preeclampsia genetic?
Preeclampsia is a very interesting illness because even now we have not yet understood it well. Because it's even in the same family, you may find one sister gets, another doesn't get, but it may run in family, yes, but its actual cause is really unknown. In fact, we call it a disease of theories, many theories, because that blood pressure only occurs during pregnancy.
Okay.
Yet when the placenta is delivered, actually the problem seems to be the placenta. When the placenta is delivered, that blood pressure just goes down.
Yeah.
So it's something which has not been completely understood. But the other thing that we know what to do with mothers who present with preeclampsia.
Okay. How do you treat pregnancy acne?
Pregnancy acne during pregnancy, pregnancy produces an oily face. Especially if you have an oily face, you are prone to acne during pregnancy. The issue is avoid oily foods, reduce your starch and sugar, eat more fruits, and don't apply oily substances to your face. And keep your face clean at least twice a day. And there are some creams on the market which can be used, but of course their safety may not be guaranteed because you're pregnant. Because remember, whatever you use on your face can be absorbed to your baby.
Yeah. Now, so, if you're saying we reduce starchy foods and maybe the craving is cassava, what happens to that mother?
No, okay, I'm not saying that you don't eat your carbohydrates, do by all means, but just make sure that portions you eat are more of proteins and vegetables.
Okay.
And yes.
Okay. Is it normal to have chills or feeling cold during pregnancy as opposed to feeling hot?
If you are feeling chills in pregnancy, then you need to be checked because chills is a sign that you could be having fever. And pregnancy mothers are always feeling hot. Unless it is definitely a very cold day.
Okay, so that one needs to go and get checked.
Yes.
I gave birth to my first child at 41. Now, 1 year down the line, I still have backache and knee pain. What can I take to help ease pain?
For mothers, it's good to know that pregnancy demands a lot from the mothers, especially towards the 3rd trimester, when the baby is really consuming your calcium, your magnesium, and this is mobilized from your muscles, from your, from your bones. And also remember, when you're breastfeeding, some of us don't have very good postures because when you're breastfeeding, you must always support your back. If you don't support your back, you'll have low backache, which can be debilitating. So the first thing you need to do is, if you're overweight, you need to reduce that weight. If you're not exercising, you need to do some bit of stretch exercises. They help for the back, to strengthen your back. Like swimming is very good. Thirdly, you can also supplement with something like magnesium or calcium. Carol, can you hear me?
We can hear you, Doc.
Okay. Yes. So basically for low back pain, that's what I would recommend.
Okay. My cervix got torn while giving birth in my first pregnancy. Will this happen again while giving birth for the second time?
Yes, cervix can get torn. It doesn't mean that it will get torn during the next time. But the good thing is when the cervix gets torn, we're able to stitch it back.
Mm-hmm.
So it doesn't have to get torn again. But what I would recommend is this, even for all mothers. Mm-hmm. Do not push your baby before you've been told by your midwife or by your doctor to push. That is the time when you're delivering. Because when you push the baby before the cervix is completely open, then you tear the cervix.
Oh, but I know I have experienced that. I didn't tear the cervix, but I experienced a situation where you're told not to push, but there's this pressure that is coming from inside that you can't hold. So what is the mother supposed to do at that point?
The breathing movements, Lamaze classes.
Is there anybody who remembers breathing movements at that time? Okay. Up to what age is it safe to carry a pregnancy? For example, after 40 years, up to what age is considered safe?
I think one can carry a pregnancy up to whatever age you are physically and mentally and emotionally able to. We have seen 60-year-olds carrying, pregnancies. So it depends on your body ability and also your mental health, your physical health. Because there's still some people even who may be in their 30s and they're told not to carry a baby because maybe they have severe heart problems or they have severe this. Then you have a 60-year-old who is so fit and she's able to have her uterus borrowed to carry her daughter's baby. So it's we don't really have an upper age limit.
Okay. I'm 28 weeks pregnant, and during one of those routine check in my platelets level was slightly low. I was given some medicine, but just not sure how serious it is. Can I deliver normally?
Platelet counts tend to go a bit low in pregnancy. In fact, the key thing is the value you should look out for is 100. If the level is above 100, that's fine. That's normal. You don't even need medicines if they're above 100. If they are below 100, then that shows something needs to be checked. Could you be having high blood pressure? Could you be having a blood disorder? What is eating up the platelets? That is if they're less than 100. But above 100, relax. There's no problem.
Okay. When you get pregnant with an IUD in, do you remove it or carry it to term with the baby?
Pregnancy with an IUD is one of the most psychologically dampening times in a woman's, period. Because I have seen several cases where, clients have conceived with a coil. And the first thing you need to do is to remove it. If you know you have gotten a pregnancy and you have a coil, remove it. If you are not able to, if the doctor is not able to remove it, then he'll say, okay, let's continue the pregnancy, but you keep on checking whether we're able to remove. The only problem is this, is that coil, even when you've accepted the pregnancy, you'll find when you reach at a certain gestation, maybe 16 weeks or 24 weeks, then you suddenly get this preterm delivery.
Oh dear.
Because the coil causes a kind of an inflammation, which kind of makes you go either into labor or you start leaking water. But there are also some women who are lucky enough that they're able to go with the pregnancy up to term, which is fine.
With the coil in?
With the coil in. And it comes out attached to the placenta.
Okay. Not being held by the baby.
Not being held by the baby.
Okay. How can you handle your woman to deliver a specific gender? This must be a question from a man. They want either a girl or a boy. So how do they get it?
it's a difficult thing. It's not 100%. The only sure way of doing that is through IVF, where there is gender selection. People have tried to use Chinese calendars. People have tried to use some certain foods they eat. Try to take some calcium if you want to have a boy, and use of bicarbonate of sodas to do teaching, but they don't work 100%. The only sure way is to do an IVF.
Okay. Please advise a HIV positive lady who wishes to get a baby at 45 years. They do not have a husband, but they want a safe option.
Oh, HIV mothers nowadays can get babies easily. We have delivered so many of them. They can conceive. There is hope. The most important thing for HIV mothers is this. Make sure that you're on your medication and you have completely eliminated the viral load. The medication, HIV mothers take medication to reduce the amount of virus in their system. And sometimes they can reduce it to what we call undetectable levels. Then from there, it is possible now even to get even a sperm donor from an IVF, or even from what we call intrauterine insemination, and they get their babies.
Wow, okay, so that's the
but
option.
We like to, yeah, they can actually do insemination, or they can do an IVF. Can you hear me, Carol? You can hear me?
Yes, we can hear you.
Okay. All right. So basically for HIV mothers, they can conceive. And but what you have noted is that if their viral load is high, then they are more prone to miscarriages. So it's always important to make sure that their viral load is undetectable or less than 1,000.
Okay. Okay. I think we have done all questions for the evening regarding pregnancy. Just one question, last question, maybe I would like you to tackle is on dangers to look out for post-delivery. So, you know, most of the time we only hope that we give birth to a baby. And now after we've given birth to a baby, what are the dangers that the mothers should look out for post-delivery? We've had instances where women bleed to death, they get sepsis. So what are some of the dangers they need to look out for?
Anytime you are discharged from the hospital after delivery, it's important that your health worker tells you about the danger signs to look out for both your baby and yourself. And for the mother, what do you look out for? One, severe headaches, blurring of vision, or even convulsions. Those are signs you may point out towards high blood pressure.
Okay.
Because, and also eclampsia. So bad headache, where you're swelling of your face, that is a danger sign. Number two, excessive bleeding, where you're changing pad after pad every hour after hour. Then you know that's a danger sign. If you start getting a fever, start feeling chills, that is a danger sign. If you start having a foul-smelling vaginal discharge,
okay,
then that's a danger sign. If your breasts are extremely painful, even to touch, that's a danger sign. So for the mother, the key thing is, does she have any excessive bleeding? Does she have signs of high blood pressure, like excessive headache? Does she have signs of sepsis where she has chills and foul-smelling discharge? Those are the main things which mothers should look out for.
Okay. Now we could be having, yes, for the baby, just go ahead.
For the baby, it's also important for mothers to look for this. One, is the baby crying too much? Is the baby passing urine? Is the baby becoming yellow? Is the baby refusing to feed? Is a baby looking excessively sleepy, even on waking? Is there any fever with the baby? Has the baby passed stool and urine? So those are important danger signs for the babies to look out for.
Okay. We could also be having some new mothers listening in. When do they expect to see breast milk come out? Because I know that is one of the questions I would have asked if I was a new mother.
Breast milk. Breast milk can occur anytime during pregnancy. And most of the time it has to occur from 28 weeks when they start seeing like colostrum coming out. It's almost, colostrum looks like water, but it may look yellow. And we recommend mothers not to, to express. There are also mothers who sometimes they conceive when they're still breastfeeding. We still allow them to breastfeed during pregnancy.
Okay.
But it's safe to have breast milk coming up when you're pregnant.
Okay. Well, I've seen several ladies get affected by the anesthesia spinal injury, even up to death or paralysis after birth. What is the cause?
It's extremely rare to have that. In my lifetime, as again, I've never seen that. But it's there in textbooks that very rarely may occur, and it's something, and spinal anesthesia is an extremely safe form of anesthesia. And most of the backaches the women may complain about tend to come as a result of postural problems. Not having good posture after delivery. Yes, a little soreness on the back is common, especially the first 2 weeks, but it tends to go away. It doesn't get prolonged.
Okay, and the last question of the night. My wife is in 3rd trimester and her legs are swelling a lot. Her blood pressure is okay. What could be the cause?
Swelling of the legs in pregnancy is normal. What we worry about is swelling of the face and of the hands, where we worry about high blood pressure. In fact, another common swelling of the legs occurs after delivery.
Yes.
Many women swell their feet, almost nearly all swell their feet after delivery. And that is common, and that is normal. So she just needs to elevate her legs when she's resting, even when she's sleeping. Just elevate the legs, and you'll find by morning the swelling has subsided.
So thank you so much for joining us this evening. It has been a wonderful 3-part series. I think we have learned a lot as women. We look forward to having another similar series in the near future, because I think there's a lot that women need to discuss and just ask about themselves, their reproductive health, pregnancy, etc. So thank you so much for finding time out of your busy schedule to join us. And thank you so much for listeners who have been consistent throughout the 3-part series. Look forward to more in other areas, not just necessarily reproductive health. And keep coming, keep listening, keep learning. This is a very important period for us to just gain important information about our health. So thank you, everybody. I would want to wish you a good night and fantastic weekend. If you want to see Daktari or you want to know where he is, for those ones who are joining us for the first time, Daktari, please tell us where you're located.
I'm located in Hurlingham, Hurlingham Shopping Center. My office is at Nyaku House. That is just on top of Absa Bank in Hurlingham on first floor. That's where my office is.
Okay. Thank you so much. Good night, everybody. I hope you enjoyed. I hope your questions were well answered, and I wish you a fantastic weekend. Good night.
Good night.